or so, what actually happens to that curve. That's really, really important. So, we'll keep everybody informed. But even beyond that, you just got to keep going. In countries like China, like South Korea, and others, they had many more cases, of course, but it took them, quite a few weeks and overall about 2.5 months in order to get their bigger outbreaks under control. So what I would like to see in Canada, of course, is to not even get there, but which is why I'm saying, plank the thing, plank it right now. So I'll see how Canadians do in the next couple of weeks.
Have right now, can you give us a sense of how severe they are, what the demographics are in terms of age and gender, and how that compares to other countries who are sort of ahead of us in terms of this pandemic?
So I think the demographic profile is similar in that there's quite a large number of cases in the sort of working adult age group. But the severe illnesses are occurring in the older age group, particularly people over 70 years of age. Some of the deaths that you've just heard reported would actually, at least 6 were related to a single long-term care facility. So from my key message is that anything that we do should be to protect these very, very vulnerable settings. Do not let the virus enter any settings where older people live and people with underlying medical conditions, because this is what some of the impacts would look like. I think that's what we're seeing now.
Brett Forrester.
Minister Miller, as you well know, First Nations children and Indigenous communities struggle sometimes to get access to funding, which is why we have Jordan's principle, for instance. How are you going to make sure Indigenous communities can access this funding quickly and cut through this red tape?
Thank you, Brett. That funding continues. It continues, and it is on the request basis that we have addressed at the department, even for systemic asks. So we are moving as diligently as we can to deploy those monies to children and into communities. Oh, the $305 million. Well, that's precisely what we're discussing in our departments today. Our expectation is to deploy that money out as quickly as possible into communities. And that's my instruction to my team.
That some communities were particularly at risk for pandemics like these, and that was back in 2009. So what's been done since then to prepare for something like this?
Well, a number of things, Brett. The historic funding that we have put into housing, which is still hasn't addressed the undercapitalization in communities to address overcrowding, goes to the social determinants that make Indigenous communities vulnerable at the outset. This is unacceptable. The deployment into ensuring the removal of boiled water advisories, heavy investment into infrastructure to make sure that we're addressing those social determinants, building of hospitals, increasing of capacities, funding under Jordan's principle. These are all critical elements that have closed those socioeconomic gaps that are absolutely unacceptable in a country as ours. We have the world's best healthcare system, but Indigenous peoples are the first people to be negatively disproportionately affected by it. We cannot shy away from that. In terms of our lessons learned from H1N1, a number of things, and I would ask Dr. Tom Wam to elaborate on what I say, but some of the measures that we're putting into place, the basic public hygiene messages of social isolations, quarantining in some case, separation, hand washing are key to ensure that curve is flattened. As the way Dr. Tam has described, these measures should be underscored at every single opportunity. Then we get into issues that you address, which are capacity, making sure that communities have their pandemic plans in place. 87% of communities have reported that they do have plans. We will help them update them for this one. In the first wave of H1N1, as I mentioned earlier, there were disproportionate regions that were affected, and Indigenous communities, and sometimes were 3, 4 to 5 times more affected by H1N1 than non-Indigenous communities. We recognize this, and it's because of the social determinants that I described to you earlier. These things are unacceptable. We cannot shy away from the fact that this is not a question of if, it's a question of when, but Indigenous communities have a chance to prepare and address this and flatten the curve on a community basis. There is also a number of related elements into remote and isolated communities that we need to address. People that are high risk. I think immediately of women that need to give birth. Sometimes they need to go out of community. They need to have the supports in place so they're not overcrowded, that they're transported in private cars, and we will have funds and resources deployed to them so that they do not become carriers, and that their birthing experience is done in a fashion that, as any non-Indigenous Canadian would expect. These are all elements that play into a strategy that will address this and to flatten that curve for non-Indigenous communities, considering and respectful and understanding of that vulnerability. Dr. Wong.
Thank you, Minister Miller. We support Indigenous communities in preparing and planning for any kind of emergencies, including, as Minister Miller said, that over 85% of the communities have emergency plans. Involved in that is, we support communities to plan, to prepare, as well as to exercise, testing the plans, as well as implementing the plans. And with the additional investments that we heard recently, that would be tremendous help for the communities. One of the things that we have to remember is the social determinants of health. We support the communities in addressing those issues, and the solution has to be a partnership between governments, public health departments, provinces, territories, and the communities. Indigenous communities have been telling us about something that's so important, which is culture as prevention, culture as treatment, and culture as resilience. And that's something we support. Thank you.
Brett, please ask away.
Reserves remote communities are calling states of emergency right now. What do you do when that happens? How does the government react?
We react immediately. We take every state of emergency declared by a community with the immense respect that the decision-making process that those communities took to declare the state of emergency. Not all state of emergencies reflect the same realities on the ground. Some communities are more vulnerable because they are subject to historic flooding. And so in tandem with that and thinking forward of the impact of COVID-19 on those communities, they, as a precautionary measure, will declare a state of emergency. So they make sure that those resources and that and their capacity to plan internally is reflected in their feedback to us as a government. So we will engage, and my team engages with them directly. Other communities will declare states of emergency because of their specific reality on the ground. I think of Six Nations that has done so. They want to put into place and allocate their resources and get a seamless communication out to their community in a fashion that respects their internal protocols, and that's something we have to respect. Some communities that are remote and isolated want to put in plans to prevent people from coming and going, and that's something that we need to engage and respect and reflect allocation of resources. I want to be clear, though, that if a community declares a state of emergency, that is not a precondition to accessing this funding. They do so for their own reasons. They're reasons that we respect, but they are reasons that declare their state of urgency, and in some cases, it allows them to move forward on a quicker basis with their own community planning.
So maybe one last from the room, and then we'll go to the phone because you have a lot of colleagues there.
No, we were all promised questions. I have two short questions.
So we have a little less than 10 minutes left. Ryan Timilty, National Post, please.
Mr. Duclos, you're ramping up a program here to send money to Canadians through a variety of different programs. At the same time, most public servants are working from home, and I know there's been challenges with them able to work from home. Do you think they're going to be able to deliver these programs with all of those challenges?
Well, we are very fortunate to have in Canada a public service of amazing quality. And that's true in international terms as well. And we understand the challenges that they themselves go through in their personal lives. They also are fully mindful of the important responsibility that they have in serving Canadians in these very difficult times. So we're making everything possible to protect both their health and their security and that of their family and near ones and dear ones, but also to make sure that we have all that we need to execute the type of things we announced yesterday. So we're going to do things that are extraordinary, but that's fine in extraordinary times. So there will be ways of delivering services and benefits that we have never seen before in Canada, but that will be making it more quick and more efficient to deliver the important benefits and support that Canadians will need in the next few weeks.
And on the border, how exactly is this going to work? If an American visitor shows up to a land crossing on Saturday afternoon, are they going to have to make clear that they're not coming to visit family or something like that? Like, do they have to be pulling a tractor trailer to get across the border?
What will happen at the border, and by the way, I hope is already happening now, is people should not be traveling between Canada and the United States or the United States and Canada to be a tourist or for recreational purposes. If you have an important, essential reason to cross the border, you can continue to do that. And there are a lot of people, let me give you the example of Campobello or Port Roberts. There are communities in the United States and in Canada for whom their daily life requires crossing the border, and those border crossings will continue. We've emphasized that trade will continue, and so particularly I do want to speak to truck drivers because we need them to keep on crossing the border to supply our grocery stores and medical goods, and America needs truck drivers to be crossing the border in the other direction. So trade, which is essential, border crossings, which are essential, will continue to happen. What we are saying is don't make discretionary trips, and that is what border officials will be enforcing. We believe that this should come into force from Saturday, but I do want to emphasize, don't wait for Saturday to do this. Just as we are urging people to practice social distancing here in Canada, part of social distancing is not making discretionary trips across the border. And I really hope all Canadians are doing that. And we've been asking Americans to do that too for a while. And the US government is on board with that approach. I think it's all about being good neighbors to each other.
The gentleman from Blacklocks, please.
3 weeks ago in Commons Health Committee that border closings are pointless. There's zero evidence that border closings spread or limit the spread of any pandemic. Can you elaborate? The science hasn't changed in 3 weeks. Can you elaborate on that point?
Certainly, from a public health perspective, we've always said that border measures alone won't stop the introduction of a virus into the country. Because as I mentioned at the hearing, that obviously people can be asymptomatic and also enter the country. However, we've also said that border measures are one component, one layer of a multi-layered system, an integrated system. The most important part of the system, obviously, is the healthcare system, public health, integrated to be able to rapidly detect cases, isolate them, and follow up on contacts. And we've done a great job so far. That's what's been happening.
Minister Freeland, I want to ask about your main estimates. There are millions of dollars in there that will be lapsed appropriations. $96 million for the Tourism Commission, everyone's staying home. Department of Veterans Affairs, $43 million. Nobody is flying to Amsterdam for VE Day. So speaking of unnecessary